The Compliance Perspectives podcast is sponsored by Athena, customizable compliance training, an employee hotline, and case management all in one tool. Welcome to the Compliance Perspectives podcast. I'm Adam Turteltaub from the Society of Corporate Compliance and Ethics in Healthcare Compliance Association. Joining us today from Washington, D.C. is Greg Demske. Greg is a partner at Goodwin Procter and formerly served as Chief Counsel to the Inspector General at HHS. And today we're going to be talking about what's going on in healthcare enforcement. Greg, thanks for taking time out of your day to talk to us. The Trump administration, as you know, promised many changes for enforcement across the board, including in the area of healthcare. Thus far, how, to your mind, has the change of administration affected healthcare fraud enforcement and compliance?
Well, first of all, hello, Adam, and glad to be here. And it's always a pleasure to talk with the HCCA audience. So really, among all the changes across the Trump administration, I would say that healthcare fraud and enforcement and what compliance officers in healthcare need to be thinking about has not changed as significantly. And as you look at the Department of Justice, the Trump administration has reprioritized a lot of the activities of that department, as well as a lot of other parts of the government. But if you look at what the Department of Justice is doing, both on the criminal side and the civil side, there's been no let up, that's for sure. And we're seeing, if anything, enhanced focus on healthcare fraud compliance and enforcement, which, as you know, have been priorities now for many years across many administrations and really has been a bipartisan priority. And I guess I would point to a few things. The Department of Justice, along with federal partners and state partners, have engaged in what they've called various times takedowns or enforcement actions, usually announced in the summer every year. And this year, in June, they announced what they called the largest ever takedown, which was primarily focused on criminal actions, over 320 defendants charged, and over $14 billion of alleged fraud. So that was by far the most alleged fraud in one of these actions. So to me, that signifies a continued and maybe even enhanced commitment to bringing healthcare fraud cases criminally. And as with all of these actions in the past, there's also the government talks about the coordination within the federal government and with state governments and the geographic reach of these actions. So that's what's going on the criminal side. On the civil side, that's where the False Claims Act is. And the False Claims Act is a big healthcare fraud enforcement and compliance issue for anyone operating in this area. And similarly, all signals from the Department of Justice are that the Trump administration is going to continue to prioritize healthcare fraud in its False Claims Act activities. So they may have different points of emphasis, and they have added some different priorities, but they've emphasized that healthcare fraud continues to be a priority area. And I just wanted to mention one change at the Department of Justice, which we'll have to keep our eyes on because we don't know how that's going to play out. But one of the senior leaders at the Department of Justice in the Civil Division, there's a new person there, and it's Brenna Jenny, who had been a healthcare a defense attorney, but prior to that had been a senior official at the Department of Justice and HHS, and she's formed a DOJ HHS False Claims Act working group. And so we're going to see how that plays out in the future, but that could lead to even more coordination between those two departments and enforcement activities.
Yeah, it'll be very interesting to see what becomes of that task force. Now, my next question was going to be, what are you seeing on the ground in terms of enforcement? But I think in large measure you've answered that. Or are there more things that are worth pointing out?
Well, I guess the only thing I would add is that so much enforcement traditionally is driven by key TAM filings. Last year was the greatest number of key TAM filings under the False Claims Act, the whistleblower actions, which then get filed in federal court and require the government to investigate them. We've seen no let up in that, and we've seen no let up in the number of civil investigative demands or investigative activities by the government, and the government continues to talk about how they're going to use data analytics and advanced technologies to identify potential targets of cases. So more the same in terms of the level of enforcement, and there'll be some changes in priority areas.
So let's talk about the courts. Are there any significant legal developments in the courts affecting healthcare enforcement?
Well, to me, the most significant development from the last few years is the super value case, which was a Supreme Court case from a couple of years ago, which really, for the first time, clearly stated that liability under the False Claims Act turns on a party's intent, so their subjective intent at the time of the conduct. And to me, that really puts a premium on compliance, because it means that if you are an entity, if you have a good faith reading of what the requirements are, you can document that at the time, and you're looking at the guidance from the government as well as the language of statutes and regulations, and you have a pretty good idea of what's out there, then you're in pretty good shape. And you can, regardless of whether the government later comes back and says that that's a violation, you should have a pretty good defense based on your knowledge at that time. So I think that that's a really something that all compliance professionals should be mindful of and be thinking about in guiding their organizations. We're seeing some of that play out now in cases. And a hot area for lawyers, but I don't know that it has a big impact for compliance professionals, is the link between the anti-kickback statute and the False Claims Act, what's sometimes called the causation standard, and we've got different circuits coming out in different ways. There's a First Circuit decision from this earlier this year. Again, that's interesting legally, but I don't know that it changes, and it certainly doesn't reduce any need to be very focused on AKS compliance for any organization operating in healthcare. And then really there was a spate of significant Supreme Court cases last term, and we're still sort of seeing how those are going to play out. The Loper-Bright case, which reduced deference toward administrative agencies in their interpretation of statutes, overturning the Chevron doctrine. That's very significant. Corner post, maybe not as significant, but it opens up more challenges to regulations. And then the Jarkissi case, which calls into question the authority of the government to bring administrative civil money penalty cases. All of those, we don't really know the full way that they're going to play out over time, but I think one potential, particularly with Loper-Bright and Corner Post, is that you're more likely to have sort of different sets of rules across the country based on different rulings from different courts, instead of a reliance on one nationwide federal agency or federal regulation from an agency. So that can create compliance challenges, but also opens up the door to entities making reasonable interpretations along the lines of the super value analysis I was just talking about. So a lot of things happening now that could affect how cases might play out, and compliance officers should keep an eye on those developments.
Now, let's move over to CMS, which Dr. Oz is heading up. He said they'll be focusing on waste, fraud, and abuse. Do you expect something vastly different, or just the same focus, only with greater resources?
Well, it was very interesting. Dr. Oz's confirmation hearing to be the CMS administrator, he stated that he was very focused on Medicare Advantage and fraud in that program and efficiency. And since he's become the administrator, we've really seen real action, substantial action from CMS to say that they're going to go from editing auditing 50 Medicare Advantage plans a year to auditing every one, around 600 plans every year. And to do that, they're going to leverage technology, they've said, and they're going to increase their staff from 40 coders to 2,000 this year. So we certainly are seeing a lot of places where the government is reducing staffing across the country, or across many different agencies and across the country. Here's an example of a huge increase in government resources that Dr. Oz has announced to address Medicare Advantage. And I would emphasize that Medicare Advantage affects the plans, but it also affects the providers that are downstream of those plans, because the government is going to be looking at their coding and their activities under Medicare Advantage. It all falls within that large umbrella. So that's one area of huge focus from CMS and actions to support that. And as part of that, we've seen that the CMS has now required the plans to make any amendments to their diagnosis coding on a very expedited basis relative to what was being done before. More broadly, CMS has also announced sort of a fraud war room, which sort of builds on a lot of the data analytics capabilities that they had established over the years. So it does, as with DOJ, I would say it's building on what has been a multi-administration focus on addressing fraud, and at CMS it's a focus on addressing it at the front end and using their administrative remedies and working with their government partners. So we're definitely seeing increased activity on that front from CMS.
So finally, is there anything else that compliance teams should be watching for out of Washington to ensure that they're staying ahead of the game?
Well, I think the advice is probably the basics are not that different. Keep an eye on what the government is saying. CMS, through its announcements, both with respect to how it's rolling out any of these program integrity or anti-fraud efforts, and some of the things that it's doing to look at innovations in how they pay for services. As always, look at the OIG website, which will show what their work plan is at OIG. And they continue to issue advisory opinions. They continue to enter into corporate integrity agreements and pursue administrative actions. We're hoping, or at least I'm hoping, to see more, continue to see compliance guidance from OIG. We had expected to see a Medicare Advantage compliance program guidance earlier this year. It hasn't come out yet, but I would anticipate that that would come out at some point. And again, that's tied to the priorities that are across the organization. And then I would really look at this thing that I mentioned earlier, this DOJ HHS False Claims Act working group, and see if something more comes out of that. They've identified, and other officials at the Department of Justice have identified, areas of focus, whether it be Medicare Advantage, certain types of kickbacks, electronic health records, driving inappropriate utilization, also things that are a little different from what we've seen in the past, a focus on access to care, and also they articulated a concern about medical devices and whether they were defective, and pursuing cases against the manufacturers there. And interestingly, Department of Justice also mentioned payment suspensions, which is a CMS remedy, and CMS has the authority to cut off payments through a payment suspension pending an investigation of alleged fraud. And that's been used very sparingly over the years, but it'll be interesting to see if there's more activity on that front based on what the Department of Justice announced. And then we'll just see where they prioritize. But having this working group means that I think that we'll hear more from them in the future that could inform compliance risk areas and what entities should be focused on.
Well, there's a lot to be watching out for, that's for sure. Greg, thank you so much for sharing your insights with us today. We appreciate it through the years and glad to hear from you in your new role. I want to thank all of you for taking the time to listen. I'm Adam Turteltaub from SCCE and HCCA. I hope we're able to expand your compliance perspective.